Welcome to Advanced Dermatologic Surgery. If you're watching this right now, it likely means you've recently undergone a skin graft procedure. First things first, take a nice, deep, relaxing breath. The procedure is completely behind you, you've done the hard part, and your body is already jumping into its incredible healing process. Today, I'm going to be your guide through your recovery journey so you know exactly what to expect. You are in expert hands with us. What we're going over today is your standard, definitive care protocol. By following this simple recovery roadmap, you're setting yourself up for the absolute safest, most successful recovery possible. You don't have to guess about a single thing. We have the entire path completely mapped out for you. Okay, let's dive into this. Our agenda today covers: number 1, what to expect immediately. Number 2, graft versus donor sites. Number 3, your daily routine. Number 4, medications and activity. And finally, number 5, after 1 month. Starting with Section 1, what to expect immediately. Right now, if you are looking at your surgical site and feeling a bit overwhelmed by the colors or the swelling, please know that bleeding, bruising, and swelling are completely normal. In fact, bleeding is totally expected for the first 24 to 48 hours. Your bandage might even get completely saturated and leak a bit. If that happens, here's exactly what you do. Press firmly and directly right on the surgical site with some gauze, a clean paper towel, or a washcloth for 30 full minutes. No peeking before that 30 minutes is up. Also, expect some color changes and swelling. If your surgery was near your head, your eyes might actually swell shut, or if it was on your nose, it's going to feel stuffy. This is all just part of the process and will slowly go back to normal in a week or two. Now, what's really interesting about this slide is knowing exactly what to look out for just to be safe. While some bleeding is totally fine, we want to gently keep an eye out for a primary complication called hematoma. The warning signs are super specific. You're looking for a rapidly expanding, firm or tense lump, a dark purple mass, severe increasing pain, or any sudden problems with your vision, breathing, or swallowing. If you ever experience these specific symptoms, you simply call the office immediately. It's just a standard safety check so we can support you. Moving on to Section 2, graft versus donor sites. Let's clear up one of the absolute most common points of confusion, understanding the difference between your two surgical sites. You have a graft site and you have a donor site, and they require totally different care. Let's look at the graft site first. This is covered with a flesh-colored tape bandage. The strict golden rule here is do not remove this bandage. It is not waterproof, so you've got to keep it strictly, completely dry until your follow-up appointment. Basically, keep it out of the shower. Now, contrast that with your donor site. This one has a large, bulky, white pressure bandage on it. We just use that to help control bleeding. You keep that bulky bandage on for 24 hours, and then you can take it off and go ahead and grab a shower. So remember, the graft site stays perfectly dry and untouched. The donor site bandage comes off after 1 day. Up next is Section 3, your daily routine. So the crucial point is figuring out what you actually need to do every single day to actively protect your healing skin. It's a super simple 3-step daily habit. Always wash your hands first. And then step 1, clean the incision gently with just mild soap and water. Step 2, apply a really generous amount of Vaseline. Slather it on. And step 3, cover it up with a clean bandage. Literally any standard bandage you have at home works perfectly fine. It's just a gentle, moisturizing, protective routine. Now, I want to heavily anchor this time frame in your mind. You need to keep up this daily cleaning and Vaseline routine for 1 full month. 1 full month. It might feel a little repetitive after a couple of weeks, but consistency is absolutely key to giving your graft the perfect environment to integrate and heal beautifully. Stick with it every single day until that month is up. As you're going through your daily routine, it's a great time to gently monitor the area. Infections usually pop up between days 3 and 7. The signs to watch out for are a fever over 100.4 degrees, chills, spreading redness or warmth, thick yellow or green drainage, or pain that actually gets worse after day 3 instead of better. By the way, if you see strong itching with bright redness, it might just be a tape allergy. But for any of those other signs, please know the office is just a phone call away. We're here to help. Okay, Section 4, medications and activity. Recovery isn't just about the skin. It's about managing your whole body over the next few weeks to support that graft. You can confidently go ahead and resume all your usual medications, both over-the-counter and prescription. For any discomfort, over-the-counter pain relief is highly effective. You can take 2 extra-strength Tylenol or some ibuprofen, like Advil, every 6 hours if you need it. And if your nurse discussed a prescribed antibiotic with you today, be sure to take it exactly as directed and try to take it with food so you don't get an upset stomach. When it comes to physical activity, we have to protect the brand new blood supply that your graft is desperately trying to build. That supply needs about 2 to 3 weeks of protection to mature. Because of this, you absolutely must avoid heavy lifting, strenuous cardio, bending over, and anything that raises your blood pressure or makes you sweat for at least 2 weeks. Light, relaxed walking is fantastic, though. Also, for the first 48 hours, be sure to sleep with your head raised on a few extra pillows, and definitely do not sleep on the side where your incision is. And finally, Section 5, after 1 month. This is where we get to look forward to the really good stuff. And this brilliantly illustrates your ultimate target, 30 days. The number 30 is the absolute magic number for your recovery. It represents the transition from active, protective wound care right back into your normal daily life. Once you hit that 30-day mark, unless you're told otherwise at your follow-up, you get to finally resume your normal skincare routine. You can start applying your daily sunscreen again, you can wear makeup right over the area, and importantly, you can begin using scar reduction products like Silogen. It's a wonderful milestone where things really start feeling totally normal again. Your body is doing some seriously incredible work right now, quietly repairing and rebuilding itself. By following this standard care protocol, keeping that graft entirely dry, keeping your donor site clean and slathered with Vaseline for a full month, and taking it easy on your body, you are being a fantastic active partner in your own healing. So are you ready to take your recovery one successful day at a time? Keep this explainer handy, follow the roadmap, and you're going to guide yourself beautifully right to the finish line. Take care and get some good rest.